Are digestive problems making your life difficult?
Gastrointestinal fistula, or GIF, is an abnormal connection that forms in the digestive system, allowing fluids from the stomach or intestines to leak into other organs or even outside the body through the skin. Simply put, substances that should stay within the digestive tract find a wrong pathway to escape. This condition is very dangerous because it can lead to severe infections, dehydration, malnutrition, and even life-threatening sepsis. GIF most commonly occurs as a complication after abdominal surgeries. Statistics show that approximately 85 to 90% of gastrointestinal fistulas develop following surgical procedures. However, trauma, inflammatory diseases, severe injuries, or erosion of the intestinal wall can also trigger this problem. In some cases, no clear cause is identified, and these are known as spontaneous fistulas. Gastrointestinal fistulas are divided into several types. The first type is an enteric fistula, where fluid passes from one part of the intestine to another. The second type involves leakage from the intestine to another organ, such as the bladder, lungs, or blood vessels. The third type is an external fistula, where intestinal contents drain out through the skin. This is extremely painful and damaging to the skin. The fourth type includes complex fistulas, which affect multiple organs simultaneously and are much harder to treat. The causes of GIF are diverse, but the main ones include abdominal surgeries, knife or gunshot wounds, inflammatory bowel diseases, infections, and chronic medical conditions. In some cases, added pressure on the gastrointestinal system due to pregnancy or obesity can also contribute to the formation of fistulas. The symptoms of a fistula depend on its type. If it is external, there may be fluid discharge through the skin, abdominal pain, fever, elevated white blood cell count, and bowel obstruction. If it is internal, symptoms may include diarrhea, severe infections, dehydration, rectal bleeding, malabsorption of nutrients, and rapid weight loss. The most dangerous complication is sepsis, which occurs when infection enters the bloodstream. Sepsis causes a sudden drop in blood pressure, organ failure, and can be fatal if not treated quickly. Diagnosis involves several methods. Blood tests help evaluate electrolyte balance, nutritional deficiencies, and overall health. Endoscopy allows doctors to directly examine damaged areas of the stomach or intestines. Imaging tests such as barium swallow, barium enema, X-ray, CT scan, and ultrasound are also important to locate and assess the fistula. Treatment of gastrointestinal fistulas depends on their type and severity. Some small fistulas may close on their own within 30 to 50 days, but close medical monitoring is required during this time. Supportive care plays a key role in management. Since normal digestion and nutrient absorption may not function properly, patients are often given intravenous nutritional support. In addition, medications such as proton pump inhibitors, loperamide, or drugs that reduce intestinal secretions are used. If the fistula does not close on its own, or if infection worsens, surgical intervention may be necessary. During surgery, the damaged area is repaired or a special drainage system is placed. In recent years, endoscopic techniques have also become common, where doctors use special sealing materials to close leaking sections without major surgery. The major complications of GIF include sepsis, nutritional deficiencies, and severe infections. Because proteins, vitamins, and minerals are lost in large amounts, the immune system weakens significantly, making patients more vulnerable to other diseases. Prevention is extremely important. After abdominal surgery, patients should be carefully monitored for fluid balance, proper nutrition, and signs of infection. Maintaining a healthy lifestyle, treating inflammatory bowel conditions on time, and undergoing regular medical checkups also reduce the risk of fistula formation. In conclusion, gastrointestinal fistula is a serious medical condition that can become life-threatening if not treated properly. However, with early diagnosis, appropriate treatment, and supportive care, the risks can be significantly reduced. Recognizing symptoms early and seeking medical attention may save a patient's life. Managing this condition requires teamwork between doctors, patients, and caregivers to ensure the best possible outcome.